All right, so we'll switch to the last but not least session of the talk. It's very important, I think. We thoughtfully designed this to focus on things beyond ECD, organs, and so forth, responses, and those things. So we are going to talk about the general medical health, mental health, physical health, and those aspects. So we will kick off by the session on general medical management for ECD by our own Kevin O'Brien. He needs no introduction. He just led the previous session. And, please, Kevin, take it away.
Thank you.
It's yours. Stage is yours.
Thanks. Okay, everybody. Thanks. So I only have 10 minutes, so I have to go through the slides very quickly, and I have a lot of content, so I'm going to use the script here to make sure that I cover everything. So fortunate for you, you only have to listen to me for 10 minutes more. So what we're going to do today is talk about general medical care, which really boils down to self-care. Now, this talk is a little bit different than what I just discussed because this is about the medical management of other common conditions that we all get throughout life, but that can have a big impact on your overall health and your overall ability to function. So there's a couple of things that I need to get straight before we start. The first one is that we're going to be talking about behaviors and decisions that people make each day, some of which may not be healthy for us, right? In some cases, it could be something like substance use. So the important thing that I want you to know is that this talk is not about criticism or judgment. It's about helping you to understand the various ways in which you use to cope with things that you go through and how you can reflect upon that and maybe learn a better way to cope, especially if a behavior that you typically use to cope could be harmful, all right? So this is not about judgment here. Secondly, what I want you to know is that, as you can see from these slides are information dense. And I arranged them like that purposely because my intent is that after the conference is over, you'll be able to go through these slides. I submitted these slides to the ECDGA, and you'll be able to take your time and read through them. I'll also be submitting all the references I use, so you'll be able to do research on all of this. All of what I'm talking about today is evidence-based. Third, I want you to know that instead of trying to read all the text on the screen, we don't have time for that. I have to move quickly through the slides. Look at the images that I put on the right side of the slide. Those images, I chose them and I drew some of them out before I had them made. They are visual metaphors, okay? Just like they're parables. Does anyone know what a parable is? Parable is a fictional story or a picture that, though fictional, transmits an important truth, all right? So think of them as visual parables. Understand that, okay? And then lastly is that I'm going to show you some things, and I'm going to have a phrase that I want you to repeat with me. It sounds kind of silly, but actually it's a mantra, just like the famous mantra Om, right? Mantras are an example of where words can be powerful like pictures. So I want to kind of set this up in your minds so you can think about this long after you leave here. Okay, so getting started here, we're going to talk about two big ideas that are going to anchor our talk. These are both medical concepts that have been researched and refined over decades, and they've been very fruitful for both research and care. The first one is called burden of disease, or I just may call it disease burden. Defined simply, the burden of disease is the total impact of an illness on your life, the total impact. So we're talking about physical symptoms like pain, fatigue, difficulty chewing and swallowing, poor balance. Those are physical symptoms that get in the way of you being able to function. And it includes organ dysfunction, as some of you have trouble with your kidneys or how your heart functions or how your brain functions. But just as importantly as that, it includes the emotional and psychological strain and toll that having a serious illness like ECD will inevitably have on you. That's part of the total impact of that illness on your health and life. All of these things then alter your ability to function on a day-to-day. So what I want you to see here is that the more conditions that you have, the greater the burden of disease, the lower quality of life. This is going to be one of the mantras that I'm going to be repeating throughout this quick talk. All right? So the next idea is what I call health stewardship, though it goes by other names. And defined simply, this is how you actively care for yourself. That is to say, the decisions that you make each day that are going to have impact on your health. And sometimes it's very simple things, what are seemingly simple, like what you're going to eat, what foods you're going to choose, if you're going to be active or not, how are you going to engage or not engage your care team. Because what I want you to know is, as you see on the slide, you need to be an active partner in your care, not a passive recipient, okay? So health stewardship is also about building habits day by day that can either support your health or you can engage in habits that may work against your health. We're going to talk about some of those things. Ultimately, what I want you to know is that you need to be an active partner in your care. What I don't want to see is for someone to come in to their doctor's office and they sit down and the physician is asking you how things are going and you look at your spouse or you say, I don't know, things seem okay. I want to encourage you to be an active partner. That helps you to make better treatment choices. That helps your quality of life. Okay, so the first big idea, disease burden. Look at the image on the right. I was trying to think of a metaphor, a parable, as I said, right? I want the audience to say, or I want the audience to be able to say, I can feel like what the burden of disease feels like. So I have this metaphor of a backpack that you put on your back. This is something, in some way, we've all experienced. You've all carried something heavy, right? When you were in college, a heavy backpack, or maybe you carried furniture or a heavy suitcase back in the days before suitcases had wheels and you had to carry it through the airport. The bottom line is it's something that heavy. At first, when you pick it up, it seems like it's going to be okay, but as you carry it, it begins to wear you down. It becomes a burden. It wears you out. So look at the picture here. See if I can get the pointer going. ECD here can already be a heavy load in the backpack. But now you add these other things, diabetes, high blood pressure, high cholesterol levels, being overweight or obese, smoking, alcohol use. All of these conditions then begin to add more burden to how your body has to function. It adds weight to the backpack, means it's adding load to what your body has to deal with. And that's what you see on the left-hand side here. The heavier the load, the harder it is for your body to move and function, the harder it is for your body to recover, for you to get better over time, right? So here's the mantra here. Now I'm going to skip over this. The mantra that we're going to go over is more complications, greater disease burden, lower quality of life. And in some cases, it's not just a lower quality of life, it can be a shortened lifespan. The practical message, which I'll present on each slide, is what I want you to know is your body doesn't separate all of these things. It feels them all together, all at the same time, all day and all night. That's the load that your body and your mind has to carry all the time. If you begin to take out some of these stones from this metaphorical backpack, you lighten the load, and that's some of the hopeful points that we're going to talk about here. Now, the first load that gets added to the backpack is the one that I know hardly anyone wants to talk about because it's difficult to manage over time, right? Diabetes is difficult to live with because there's a lot of lifestyle changes that come with it. But it's important for you to know that diabetes is not just adding a load. It's not just adding weight to the backpack. Diabetes changes the environment inside your body. It actually can increase inflammation inside your body, which is already a problem in some people or in many people with ECD. Also, as you probably know, diabetes can damage the nerves in your feet and your legs. That can impair your balance at a time when you already may have balance issues because of ECD. That's increasing your fall risk. That increased fall risk can lead to a serious injury. Now, another important thing that many people might not know is that poorly controlled diabetes can substantially increase infection risk. And we know that some treatments for ECD can suppress the immune system and can also increase in infection risk. So now you have those two things combining together. Next, some treatments for ECD, especially some of the older ones, can increase blood sugar. And when you're already having trouble with your blood sugar because your diabetes is not well controlled, now you have two factors driving up your blood sugar, and that also then can create more damage. All right? So we also know that diabetes is particularly hard on the kidneys, on the heart, and the eyes. Look at the image here. Diabetes plus ECD results in combined physiologic burden here to the heart, to the kidneys, to your brain, especially the blood vessels that feed your brain. It increases your infection risk. So back to our mantra now. I want everybody to say this aloud or in your head. More complications, greater disease burden, lower quality of life. And in the case of diabetes, that can be a shortened lifespan, as some of you may know, of family members or friends. The good news and the takeaway message here is you can lighten that load. Monitoring your blood sugar. I know that's something that many people don't want to do, but it's important. I deal with this just about every week. Yep, thank you. Make supportive nutrition choices. Excuse me. So the next thing is high blood pressure. Just look at the picture. There is an overworked heart dealing with all these conditions that are straining the heart. Okay, what I want to say about this is that high blood pressure adds stress to your heart. Take that stress off your heart by taking care of yourself. We're going to move to the next slide. This is a slide that I spent a lot of time on because these are abnormally high cholesterol levels. You can see here what I want to show you in the image. This is a metaphor. It's not literally true, but you can see that this is an artery coming from the heart. Inside, you have the metaphor of the food. What this means is that our long-term dietary choices can affect the accumulation of fatty plaques on the inside of the artery, shown by this yellow stripe here. This can occur in an artery such as a coronary artery, which are the arteries that feed the heart, when you can also have ECD disease activity, this braided tan color here. Remember, this is not an accurate picture, it's a cartoon, right? So here you have this fibrotic tissue around the artery here. So now the artery is being stressed from the inside and from the outside. Again, more complications, greater disease burden, lower quality of life. What can you do about this? Follow a heart-healthy diet. Take the medications that you're supposed to take and stay active. All right, I'll just quickly say here that being overweight, I'm just going to point these things out. You'll be able to have time to read those. Again, the combination of two, that creates, I just want to focus on this, more joint pain. Why? Because there's physically a heavier load going down through your legs. ECD bone pain is already tough for many people, right? So now you're adding more pain. You're adding more pain because of the excess weight. Take that excess weight off, reduce some of the stress on your bones. Hopefully your pain will get better and you'll have less fatigue. All right, now we're going to talk about something a little bit differently here, but it's just as important. This metaphor that I want you to see here, I'm going to explain like this. We all have ways that we need to cope with things. And when you're ill, you just want to find something that takes away whatever the pain is that you feel at the time. And it seems to work. Over the short term, you smoke or you drink or whatever the substance is, it seems to help and you don't seem to have any bad side effects to it. So you go down the slippery slope of continuing to use the substance. But look at the metaphor here. There's a fuse or the safety ring has been pulled off the spoon. Now the spoon is up and that's going to explode. That is to say, it has a delayed effect. And that's the way it is with substance use. At first, it may not seem like it's anything bad or dangerous, but then the effects accumulate over time, and then you may experience a sudden health issue. So what I want you to know here is that you need to see where you may be relying on substances to cope with things when that is not helpful and there are better ways to cope, all right? The second big idea of your general care is what I described as health stewardship. What I want you to know here, the medications for ECD are really helpful, but they are not magic bullets, all right? You cannot just say to yourself, I'm going to take the pill and everything will be fine. That's not true. The medications, the treatments for ECD are part of a larger plan. The larger part of the plan is not the medication, it's what you do every day now, the physical therapy, the occupational therapy, the exercise, the diet, all these things that you need to do to start restoring your health again, to be able to be more functional and have a better quality of life. So what you may not know then that in this other picture, when I'm going to show you, these behaviors are leading to more complications, though they may seem helpful at first. Okay, so how do we make this change? Becoming aware, recognizing this pattern, that's the first step toward change, all right? That takes honesty on the part of the person to say, for example, using food for comfort or stress, so now you're overeating, relying on substances to cope with physical or psychological pain. Another thing that we see is that people, well, when they're overwhelmed, they will become inactive. They will spend a good portion of the day in bed or in a chair. And that can feel like that can be helpful over the short term, but over the long term, it's not. Okay, so just for this slide, take a look at the image. All of these psychological issues, some of them also physical, which add weight to the backpack, right? That's because your body feels the total load. It doesn't separate the physical from the psychological things. What affects the body affects the mind. What affects the mind affects the body. The mind and body are one, though we treat them differently. That's for more of a convenience sake and to be able to make things clear with regard to the prescription of therapies. But the body and mind are one. Okay, so this picture, I just want you to see that the decisions that you make on every day, you have the power to say, I can go with the old choice or I can choose differently. That's what awareness gives you, the opportunity to create change, to make a healthier you. So some of the things that I tell people, if you're struggling with your diet, get help for that, all right? If you're sedentary and you know you need to move, movement is medicine. Movement is medicine. I'm going to say that one more time. I want everybody to hear this in their minds. Movement is medicine. So you need to move in a healthy way. That's going to help you recover. So people will come to me after I go on this tirade for a half an hour. They'll say, okay, Kevin, you wore me down. What can I do? What's the one thing that I can do that I can start today that's going to help me get back on a healthier road? Well, the first thing that I'll say is, if you are currently abusing a substance, you know that you're using this substance, whatever it is, in an inappropriate way, that's the first thing you need to change. Because accidental overdose is still a major problem in this country. Secondly, if you are at a point where you are so emotionally and psychologically overwhelmed that you cannot function, you may be having trouble thinking straight, making decisions every day, or you may feel that you're at the point where your illness has overwhelmed you and you feel that life is not worth living, that's the most important thing that you need to focus on and get help for. But if we put aside these more urgent things, we put those things aside and people ask me, what is that one thing that I can do? Exercise. That, I think, is what I have seen, and the medical literature, which I constantly scan, shows that activity, which is safe and done well, shows some of the best short and even, long-term and even short-term outcomes for people living with a condition like you all. Now, you don't need to join a gym. You can go for a walk. And if you're having trouble walking, if that's currently unsafe for you, use a stationary bike, use an arm bike, work with a therapist and have someone stand with your stroller here, and you can move your legs like this. You can move your arms up and down. Movement is medicine. It's very healthy for you, especially when it's done right. Also, that physical movement reduces your blood pressure, reduces your blood sugar, helps to reduce your weight and your cholesterol levels. So look at, and it improves your mood too. Exercise has been shown to do that too. So with one strategy, you can have a positive influence on all these areas we've talked about here. So the final takeaway is, burden of disease is cumulative. Remember the metaphor of the backpack. Your body feels it all at one time. Many factors, physical and psychological, add to the load. You can reduce that load. You don't need to have a perfect lifestyle. All you need to do is work on one small thing, make small positive choices each day. That will help lighten the load and help you to function better and have a better quality of life. And I want to thank everybody at the ECDGA and all of you for being here. Thank you all. Does anyone have any questions?